I am a geriatric medicine specialist at Peace Arch Hospital, and my role hasn't really changed, but the way that I do things has changed. And there's just so many examples. I think the most obvious to most people is the way I look. So we put on a uniform now, which I didn't used to wear. I own scrubs and hospital shoes that get directly into the laundry and parked by the front door when I get home, with different protocol to protect my family at home. When I see patients in the hospital, I'm one of the faceless masks, gloves and goggled people. So that's one big thing. At the specialized seniors clinic where I work, there's been other big changes. And the biggest thing is that we, for quite a long time, had not been able to see people in person. And so we switched over to virtual visits, which meant either telephone visits or Zoom visits with patients that we would normally see. We've made a lot of modifications to our environment and our protocols in order to ensure safe in-person visits at this point in time. I think the biggest challenge is that we basically had to relook at the way we do everything. We've never been faced with something like this in our time. The pandemic is brand new to all, and we don't have a template. So there's been a lot of learnings and a lot of challenges that have come because of that. There's been such a big effect on the health and well-being of people due to COVID itself, but also due to the sort of unintended consequences of COVID. People presenting to hospital late and not getting the health care that they need in a timely fashion, even when it's unrelated to COVID. And there's been a lot of social isolation. And I think that's been one of the biggest challenges for seniors, both within the community, long-term care, and within the hospital. Because of all the work that's gone into preparing and dealing with the fallout of the pandemic, the hospital is actually one of the safest places to be. And so people don't need to be afraid to come. We're still here for them. We're prepared for them, and we're ready to care for them the same way we always have. So with the visitor restrictions that are in place in acute care and long-term care, there's been a lot more social isolation for both the residents and the patients in these places. And we're looking for ways creatively to help people to connect. And so the iPads have been one of the really successful ways in doing that. So we've been using FaceTime in the hospital on the units as a way for patients to connect with their families, and it's been really wonderful to see. So people that are feeling afraid, vulnerable, may have some dementia or some delirium and be more confused when they're not at home, have really found that it's been a very helpful way to calm those fears and anxieties and to connect with their family again. And it's been really special for the family who have been stressed by not being able to visit with their loved ones to be able to see them in real time and have a conversation. I've seen some really wonderful examples of that. I'm really proud to both work and live within this community. I've always thought of it as the little community that could. And it certainly hasn't disappointed in the time of a pandemic. I think the warmth and encouragement that continually are being provided through the community with words of thanks, words of encouragement, with the 7 p.m. cheer, and also through the generous donations that are made through the Peace Arch Hospital Foundation, have really made this time a little easier when we really needed it to be.